What is quadrilateral lengthening? Quadrilateral lengthening is a specialized limb lengthening procedure that involves a simultaneous extension of both the upper, femur, and lower tibia legs. This method is ideal for individuals seeking a significant increase in height as it targets all four major bones in the legs, providing a balanced and proportional result. By lengthening both the femur and tibia at the same time, patients can achieve a greater overall height increase in a shorter time frame compared to lengthening one segment at a time. Is there an age limit for quadrilateral lengthening surgery? There is generally no strict age limit for quadrilateral lengthening surgery, provided the patient is in good health and has no chronic diseases that could complicate the procedure. While the surgery is typically recommended for adults who have reached full skeletal maturity, older adults can also undergo this procedure if their bone quality is adequate. A thorough medical evaluation is essential to determine if a patient is a suitable candidate for this surgery. Is quadrilateral lengthening surgery safe? Quadrilateral lengthening surgery is considered safe when performed by an experienced orthopedic surgeon in a specialized medical facility. The procedure has inherent risks, as with any surgery, including infection, nerve damage, and complications related to bone healing. However, with modern surgical techniques and careful post-operative management, these risks are minimized. The safety and success of the surgery are enhanced by proper patient selection, meticulous surgical planning, and diligent follow-up care. What are the methods of quadrilateral lengthening surgery? Quadrilateral lengthening surgery can be performed using different methods, each tailored to the patient's specific needs and goals. There are two common quadrilateral methods: quadrilateral hybrid lengthening and quadrilateral precise lengthening. In this video, we are going to explain what is quadrilateral hybrid lengthening. What is quadrilateral hybrid lengthening? Quadrilateral hybrid lengthening is a method that combines the use of the precise 2 method and the LON method to lengthen both the femur and tibia. There are two variations of this approach. Hybrid 1, the precise 2 method is used for the femur and the LON method is used for the tibia. This combination allows for precise control of the femur lengthening while utilizing the stability of the LON method in the lower leg. Hybrid 2, the LON method is used for the femur and the precise 2 method is used for the tibia. This variation provides flexibility and strength in the upper leg while taking advantage of the precise 2's precision in the lower leg. How does quadrilateral lengthening work? Quadrilateral lengthening works by gradually extending the length of both the femur and tibia bones. After the initial surgery to implant the lengthening devices, a latency period of about 5 to 7 days allows for initial bone healing. Following this, the lengthening process begins with controlled adjustments made daily to the external fixators and the internal nails. These adjustments gradually increase the distance between the bone segments, promoting new bone growth in the gap. This method ensures a safe and steady increase in limb length. What is the role of physiotherapy in quadrilateral lengthening? Physiotherapy is a critical component of the quadrilateral lengthening process. Regular physiotherapy sessions help maintain joint flexibility, muscle strength, and overall limb function throughout the lengthening period. Without proper physiotherapy, there is a risk of developing joint stiffness, muscle contractures, and other complications that could impede recovery. A skilled physiotherapist will design a personalized exercise program to support the patient's needs, ensuring that muscles and joints remain strong and flexible, thereby enhancing the success of the surgery. How much taller can I grow with quadrilateral hybrid lengthening surgery? The amount of height that can be gained through quadrilateral lengthening depends on the combined lengthening of both the femur and tibia. The lower leg, tibia, can typically be lengthened by 5 to 7 centimeters using quadrilateral lengthening. This range is considered safe and effective for most patients and helps maintain the balance and proportion of the leg. If the chosen method is hybrid 1 or hybrid 2, the lengthening amount is the same. The upper leg, femur, can generally be lengthened by 7 to 8 centimeters. If the chosen method is hybrid 1, the maximum lengthening amount on femur is 8 centimeters with precise 2 method. If it's hybrid 2, the lengthening amount on femur can up to 10 centimeters with LON method. When combined with tibial lengthening, patients can achieve a total height increase of up to 12 to 15 centimeters, depending on their specific goals and the surgeon's recommendations. What is the recovery process after quadrilateral lengthening? The recovery process after quadrilateral lengthening involves a gradual return to normal activities as the new bone consolidates. Physical therapy plays a crucial role during recovery, helping patients regain strength, flexibility, and coordination in their legs. The full consolidation of the bone can take several months, and patients must adhere to their rehabilitation program and follow their surgeon's recommendations to ensure a smooth and successful recovery. What do scars look like? After quadrilateral lengthening, scars from quadrilateral lengthening limblengthening surgery are typically minimal and strategically placed to be less noticeable. In cases where the Precise 2 method is used, scarring is particularly minimal due to the less invasive nature of the procedure. Over time, scars tend to fade and become less prominent. Proper wound care and potential cosmetic treatments can further improve the appearance of scars, leading to a more aesthetically pleasing outcome. When to remove the intramedullary nail after quadrilateral lengthening? The intramedullary nail used in quadrilateral lengthening can usually be removed once the bone has fully consolidated and healed. This typically occurs 12 to 18 months after the initial surgery, depending on the patient's individual healing rate and the extent of lengthening performed. The decision to remove the nail is based on radiographic evidence of complete bone healing and the patient's overall recovery progress. The removal procedure is generally straightforward and involves a shorter recovery period compared to the initial lengthening surgery.